Hello everyone, it's Pam Gomez with Natural Aromatherapy. Today I'm delighted to have with me Pam Conrads. She is a BSN, an RN, CCAP, and her specialty is women's health and clinical aromatherapy, or is that women's health clinical aromatherapy. She has more than 20 years experience in medical center hospitals as a level 1 trauma, ER/OR, cardiology, psychiatrist, and women's health nurse. She is actually the owner of Aromas for Healing, and also she's studied advanced clinical aromatherapy and graduate complementary therapy studies with nurses, doctors, and midwives in England and France for over 2 years. This lady is, she is a teacher. She's developed an evidence-based curriculum in women's health aromatherapy, which is the foundation for multiple hospital nursing and midwifery educational programs. Now, I'm excited about this because my mother was a midwife, and I'm sure they didn't have aromatherapy back in those days, the 60s, the 70s, and the 80s. Especially in the Family Islands in the Bahamas. I do not think they had aromatherapy then, but I kid you not, she will be with us today. She's having a little technical difficulty. Her internet has been in and out, but we're going to cover this today. The stars will align for us, and we will get this done. We are just that determined. So I'm saying to her to just refresh and come back in. But for those of you who do not know me, I'm Pam Gomez. I'm the CEO, founder, owner of Natural Aromatherapy. It's an online business. And my aim is to bring you a series of interviews with persons in the industry. I've had on the show Danielle Hourard. I've had Gilbert Desais. Gilbert is in Canada, and he has this big Facebook group that is into aromatherapy, and they answer the most questions. There she is, Pam Conrad. Welcome, 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 Pam. I knew we gotta get this out. So before anything else happened, how are you today? How are you, Pam? Can you hear me?
I can. Holy Mary.
How are you doing today?
Trying to tell us something about this day.
No, we're gonna keep going. How are you?
I'm all right. My time is getting limited, though.
I know. So tell us, how did you get started? I just gave the persons your bio and told them all about you. So how did you get started in aromatherapy?
So I've been a nurse for about 30 years, and I was always interested in holistic and preventative medicine, and particularly interested in plant-based therapies. I grew up in a family pharmacy, so I've been around some type of remedy medicinal all my life. So I was naturally drawn to that. When, as a nurse in the medical center, they brought Jane Buckle's Clinical Aromatherapy course for healthcare professionals to the hospital that I was working at. I was just very fortunate to have that opportunity. And so I went through the 1.5-year course, and that was 20 years ago.
Have you done any other courses?
So I
Oh,
did several courses. So that was my certification. So I'm a certified clinical aromatherapy practitioner. And then 6 months after that, we moved to England. So we lived in England for 2 years, where I did graduate studies at the University of Westminster, and I did an internship with Denise Turan in women's health, specifically OB aromatherapy. And I went to France and studied with Dr. Penwall. And I also went to Oxford and worked and consulted with Ethel Burns and her team of midwives who did the 8-year study of 8,058 women.
that
So
is
I've continued
wonderful.
through the years, yes, and all
That's
those
awesome.
things.
That is awesome.
And then brought that all back to the States.
Wow, that is just wonderful. But I've got to ask you this because I know some of my viewers would want to know,
Sure.
do you have any influencers, persons you look up to in the industry, persons you admire? Can you tell
Oh,
me who they are?
there's several. Certainly my foundational course with Jane Buckle, who is certainly a nurse pioneer, and the fact that I'm a nurse, I was drawn to the medical side of things. Also Denise Turan, who is in England. They're both English, and she is a midwife. She's an international expert in complementary medicine and aromatherapy, and that's who I interned with. Ethel Burns, who is a researcher and a midwife and a professor, and did the 8-year study of 8,058 women, and then went on to Italy and did another randomized control trial. So, and there's a long list of people that I admire in many, many factions of it.
So I understand you have a business called Aromas for Healing. Tell us about your business.
So Aromas for Healing, that's also my website, and I started that when I came back to the States from England. And predominantly at this time, I'm a practitioner as well as an educator and a hospital consultant. Early on, we also compounded products. We were the first and only hospital in the United States that had a set nurse aromatherapist in the pharmacy for 5 years, compounding aromatherapy blends for typical clinical conditions like nausea and anxiety, pain, all types of things, for cancer patients, for OBGYN patients, for hospice patients, and for the walking wounded. So I've done a lot with pain and with distance runners as well.
Are your clients only women, or do you treat women and men?
Predominantly women. I have men in my life, so like all of us, you treat the people that are inside your walls and that you love. As a rule, though, my specialty and my time is spent with women's health, predominantly OBGYN.
Okay, so have you ever written a book or thought of writing a book?
So about a year ago, I was contacted by a publishing company in England that felt that there was a gap in the knowledge base and the education for nurses and midwives to have evidence-based aromatherapy for women's health. And they asked me, they knew that I had at this point about 20 years and have educated multiple nurses and midwives here and also in South America. And they asked if I would write a book. So I've just submitted the manuscript a couple of weeks ago, and it is now in the editorial process, and it is supposed to be published next year.
Great. Next year. Where will it be
The
for
process
sale?
takes a while. It's definitely a learning curve about all that.
Okay, so do you think it'll be on Amazon?
I believe so, yes.
Okay, great. So our viewers can find your book on Amazon early next year. Now,
So I believe it is due to be published in May, actually. And the name of the book, it will be Women's Health Aromatherapy. It's a clinically evidence-based guide. So it's a guidebook type that the practicing nurse, midwife, and therapist that's practicing with an OBGYN clientele will be able to quickly look, see which oils and which methods are actually clinically evidence-based, safe, and effective to use.
wonderful. So that leads me to my next question. What is your favorite, all-time favorite essential oil? Do you have one?
My favorites, hard to say
I
just
know.
one. So the two that always come to mind are frankincense. So Boswellia carteria is my favorite, and jasmine. And I like both the grandiflorium and the sambac. I use both of them, and I use both of those a lot, particularly in women's health. So I use a lot of others. I just happen to really, really love those.
Great. What would be a therapy you'd recommend to someone at home who wants to try essential oils for the first time? Is there a remedy, be it putting it in a diffuser? What remedy would you recommend someone to use at home, or put in a bath?
So certainly it always depends on the person, and I'm going to give you the answer that is probably the answer that most people would give when you're starting someone out, when you're looking at one oil that can do multiple things. Of course, it's lavender.
Yes. That would be mine.
Lavender. So I tried, when you shared the questions with me, I tried to come up with another one, and I would always tell everyone to take that as long as they weren't allergic to it. In the area I live in, there's a lot of seasonal allergies. And if people really suffer from seasonal allergies in the middle of America, sometimes lavender might make them a little bit more sniffy or itchy or those kinds of things. So it's not for everyone, but we use it thousands and thousands of times. And so to calm people, to quickly calm someone, the thing about lavender, because of how much it has been used, when we go into a hospital room, for example, introduce clinical aromatherapy to the patient and give them a choice, that's the one they've always heard of. And so we keep getting more and more and more data as a result of that. Often I'd like to also say that the citruses, and when, like you asked earlier about men, oftentimes women say to me, my husband doesn't like floral kinds of things. He doesn't like herby kinds of smells. How do I bring aromatherapy into the home? I would always recommend citruses. Citruses and scents that are like food scents. We use a lot of mandarin. It's very gentle, it's very safe, it's very effective, it's calming for anxieties. It's also good for digestive upsets, and it's very safe to use in a hospital environment as well as with your children. So that's another really good one.
I could not agree with you more. I totally agree. So,
and there's a lot of cultural components as well.
Yes, there are. So in winding up, I gotta ask you, do you have any course offerings right now?
So the course, I teach a lot of different courses, but the main course is my 2-day clinically evidence-based women's health aromatherapy for nurses, midwives, doulas, and therapists. Has 18 CNEs. It's approved through the American Holistic Nurses Association, which is part of the American Nurses Association. So you have those credentials. And my next one is October 10th and 11th in the Indianapolis area.
Wonderful. So you
can aromasforhealing.com and register for the class. So all registration is online, and I welcome anyone who is practicing, or if people just want that information for their own business, for their own practice, I do not sell any oils. I don't represent a particular oil company. So there are oils I've certainly used clinically for years that I would recommend. However, I want to teach everyone. Because my goal is that as many women in the world have access to good, safe, effective information and oils that they can use. So if somebody uses any wide variety of oils, I'm happy to teach them how to use them safely and most effectively.
Pam, I must thank you so much for sharing with us this afternoon. I also want to bring to your attention, when you mentioned your book, I had the privilege of self-publishing my own aromatherapy book last September. It was the first book I've ever done. Here's a copy, Top 10 Essential Oils for Health and Wellness. It's an introductory book, and just last month, I released a journal for the student of aromatherapy who wants to learn and want to keep all their notes in one place. When I studied aromatherapy, I had binders, okay? And I thought about it. I said, how can I assist a student with their study notes and give them a place to keep all their notes in one place? So in this journal, I added the chemical names. I added the Latin names of each essential oil that I named in the book. And I gave them some study notes, such as the country of origin, the therapeutic properties, with the parts of the plant that is used to create that particular oil. So it's a little gem for the student of aromatherapy. And those both books are available on Amazon. I just love Amazon, don't you?
Absolutely. There are a lot of wonderful books. Congratulations on your books.
Thank you
Good
so much. Thank you so much. And I just want to say there will be other interviews in this series of interviews. I've had Danielle Huard on here. I've had Gilbert DeSales. I've had Rodney's in California. Rodney Shawan. And there may have been
Linda Ann Kahn.
Linda Ann Kahn.
They're all good friends.
They are? Oh, wonderful.
Yes, lovely people.
Each one added a little gem to the series, and I'll continue doing this series. My next guest will be Georgina, and I can't remember Georgina's last name right now, but she's going to be on the 10th of September. And all of my videos are going to be posted on O Natural Aromatherapy website and the Facebook page. So watch us, continue to share, like, and comment below the videos, and we will be answering questions from the comment section. So please leave us a comment, like, share, and tell a friend to tune in, and hopefully we'll get all our tech issues sorted out in the future.
Exactly. And if you'd like, you can join my Facebook page, Aroma Tip of the Month for Health and Happiness, where I post class information and evidence-based, and also show the bar graphs and show the results of our multiple hospital programs and the work that the nurses are doing. And I'd also like to do a shout out to the wonderful midwives in Santiago, Chile, that I was able to go down and teach. And so we're able to look at different cultures and how they respond to different oils. So it's very fascinating now to move into like a transcultural women's health aromatherapy.
That is so wonderful. Thank you again for being here. That concludes our interview for today.
Thank you all. Bye-bye.